Hello, and welcome to the Thyroid Pharmacist Healing Conversations podcast. I'm your host, Dr. Izabella Wentz, and today I'm joined by a good friend of mine, Julie Matthews. She is a nutritionist, and she specializes in helping support children with neurodevelopmental conditions through diet. I'll give you her full bio in just a second, but I wanted to also let you know what we're talking about today. We're going to be talking about how to transform the lives of kids with autism, ADHD, and dyslexia utilizing nutrition. So, we're going to be nourishing hope today. Okay, a little bit about Julie. She's a certified nutrition consultant and published researcher specializing in personalized nutrition for complex neurological conditions, particularly autism spectrum disorder and ADHD, for over 20 years. She received her master's degree in medical nutrition with distinction from Arizona State University, and she's co authored two research studies demonstrating the efficacy of nutrition and therapeutic diet intervention for autism spectrum disorder. She also has a brand new book, which I was super excited to get a sneak preview of and endorse, called the Personalized Autism Nutrition Plan. Welcome, Julie. It's so wonderful to have you here with us.
Izabella, thank you so much. I'm really happy to be here.
Julie, I think one of the things that you may not know about me is that I've known about your work for maybe 10 to 15 years before I actually met you. You and I, we had a chance to meet maybe 10 years ago or so, right? I have worked with individuals with developmental disabilities and on the autism spectrum for kind of a big part of my career. So, starting off in high school, I used to work as a camp counselor assistant for children with special needs for their after school programs and summer programs and weekend programs. And then I had a few rotations during pharmacy school. At one of them was at a developmental center, and another one was at the William Walsh Orthomolecular Medicine Center. And I then worked at a case management agency in California known as the Regional Center. And this is when I first heard about your work. I went to a presentation. Woman in the community, a nutritionist, was talking about nutrition interventions for children with autism. And she shared your work and your book with me. And quite frankly, a lot of the things you recommend for autism, I used myself to help myself with Hashimoto's and get into remission. In particular, the gluten-free and casein-free diet, although I also ended up doing like full dairy-free. This is something that a lot of times works for autoimmunity as well as autism. Isn't that quite interesting?
Yes, it is. It's pretty amazing. And actually, I've discovered a similar thing. In families, you often have maybe one person with autism, but somebody else might have an autoimmune condition or digestive disorder. So a lot of the underlying factors are similar in many of these different conditions, and similar approaches help.
Yeah, it's very, very fascinating. I know for me, I've always had a passion of helping people, especially people who were underserved. Probably why I got so passionate about helping women with thyroid conditions. Well, one, because I had one myself, and Hashimoto's was part of what was challenging for me, and I wanted to overcome that challenge. But also, once I did, I knew that I wanted to help others with the same condition. Now, we know that there is actually a connection between maternal thyroid function and some of these neurodevelopmental conditions in the offspring. So, I'm just going to be reading right now. This is not from the top of my head. This is your area of expertise, but not quite mine. But we do know that women with hypothyroidism, they have a greater risk of having children with autism spectrum disorder, attention deficit hyperactivity disorder, intellectual disabilities, motor delays, speech delays, potentially lower IQ. This is a lot of times has to do with hypothyroidism. So if a mom does not have her thyroid function well controlled, these are some of the potential consequences in addition to, having a miscarriage and not being able to get pregnant. So, thyroid conditions are so important to manage during pregnancy, incredibly important. But there's also new research that even maternal thyroid antibodies can be linked to some neurodevelopmental issues. So, do you have some thoughts on perhaps the role of thyroid hormones and how they play a role in fetal brain development?
Absolutely. Well, the thyroid is crucial for proper brain development. And so, whether the mother has it or the child has that, it can affect the child. And also, there is research, as you just pointed out, with a variety of autoimmune conditions in mothers that affects the child. So, autoantibodies to brain tissue, autoantibodies to thyroid, that can affect the child and affect the brain directly or indirectly from those. And we do see the research on that. So that is one of the ways that children can be more susceptible to getting autism.
I know that I went to an Autism One conference when I was first starting to talk about how to get Hashimoto's into remission. And a lot of the people at the conference were actually of the opinion that autism is autoimmune. Would you agree or disagree with that? Or is it kind of autoimmune?
I do agree with that. I think that there's probably a number of things that causes autism, things that can affect brain inflammation, and autoimmunity is definitely one of them. So for some people, it might be a severely disrupted microbiome. For other people, it might be an immune system disorder, an autoimmune type condition. I think there's a number of ways that children end up with autism, and definitely autoimmunity can be one of them.
Okay. Yeah, I know it's kind of a controversial stance on that. So there isn't just one cause of autism, right? And so it's not like one gene or one particular cause. I know we've heard various theories out there on what could be contributing to that. And some of it is higher rates of identification, higher rates of various toxins in our environment. And very, very interesting. I know one of our mutual friends, Dr. Pejman Katarai, is doing some work with showing how mold toxicity can contribute to some cases of autism disorder, and treating mold toxicity can be a really big game changer for those individuals. Can we talk about how actually personalized nutrition and therapeutic diets can affect children with autism and related neurological conditions? Maybe ADHD, dyslexia, anxiety are some of the ones that I have moms who I serve, and they'll be like, you helped me so much with Hashimoto's and some of these things I'm using in my children. Can you share more information about like ADHD, anxiety, autism, dyslexia? Like, do you know? And I think one is women with thyroid issues have greater chances that their children will have one of these conditions. And so I would love to learn from you.
Absolutely. So, in personalized nutrition is, as it sounds, all about understanding what is going to work best for that individual. And what helps them improve is getting to the root cause or the underlying factors that are affecting that individual. So that's where personalized nutrition really comes in. And because autism is a very heterogeneous condition, or a condition that has lots of different underlying causes and manifestations, it's very different from person to person. The best approach is going to be one that addresses those specifically for that individual. And so that's what it's really about. Is it an underlying issue with an autoimmune reaction, with the gut? Is it detoxification? Is it mitochondrial? It could be a variety of those factors, but anything that's going to at some point affect the brain and the functioning of the body. And so that's what personalized nutrition is really all about. What specific nutrients might somebody need, because maybe they have certain genetic predispositions compared to somebody else? What diet might they need, because maybe they've got Hashimoto's, or they've got a reaction to gluten, and they can't tolerate it. It's creating a lot of immune system and inflammatory problems. So that's what I really do, is I look at what is underlying the individual, and what diet approaches, what therapeutic diets might be beneficial, and what supplementation might support them most specifically.
I really like that because I feel like sometimes we hear that there is like one diet everybody should follow, and that's not necessarily the case. And I hear from people with Hashimoto's and then parents of children with various conditions where they're like, "Oh, we already did gluten-free. It did nothing for us," right? but it's because it's not just gluten and casein. There's other types of foods that could be reactive. And then, of course, if you've got like a microbiome that's out of balance or severe nutritional deficiencies, then diet can only like, do so much, right?
Yes. Absolutely. And sometimes it's that's not the right diet. Sometimes it's that there could be more than one thing affecting the person. And if you only address one of the things, you might not see any benefit until you address all of the, or multiple things, the big things that are affecting them. So I've seen many times someone do a gluten-free and dairy-free diet, but let's say they also have salicylate sensitivity, for example. Until they address that salicylate sensitivity, they might not see very much change at all. And so they think, oh, well, diet doesn't work, when it might be that they just haven't reached all the factors that were a problem yet.
Yeah, I think that makes so much sense. I know in my experience with Hashimoto's, if somebody is on a severe elimination diet and they have, their autoimmune paleo and they're still not feeling better and they're losing more and more foods, I'm oftentimes like, okay, you might have a protozoal infection that's causing so much inflammation to your digestive tract that you're just going to be sensitive to no matter what you're eating. And at that point, it's like, it's not the diet. It's not like you need to get off of more foods. I feel like that's such an important distinction for, I mean, parents and anybody dealing themselves with an autoimmune condition or exploring therapeutic diets for their children.
Absolutely. And in fact, my book goes into 12 steps on diet and nutrition, but the last chapter is all about what you can talk to your doctor about, because there are things that you need more than diet and nutrition. Now, I think diet, of course, is a wonderful foundation. If we address something, but we are constantly pouring in inflammatory foods or something like that, we often need a combination, but we sometimes do need to look at what else might be going on. As you said, if you've got a parasite, I literally have a client today, if you have a parasite, that inflammation is not going to, is just going to keep perpetuating until that particular thing is addressed. And so that's why it's always good to look at a multi-phased approach to what you're doing.
Yeah, I appreciate that perspective for sure. And, I just want to make sure people listening know we're not just like, okay, you just do one thing and you're going to expect to get better. I know you've done a lot of research over the last, 10, 20 plus years on autism. Can you share some of the research, including your own personal research and on autism and neurodevelopmental conditions and how it influences the book and and the program it's based on?
Yes. So I have two studies that we've authored. My main mentor is Dr. James Adams. He works out of Arizona State University and he runs the Autism Asperger research program there. And so we did two studies. One was on a 6 diet and nutrient protocol implementation. So a gluten-free, casein-free, and soy-free diet. Then we looked at a multivitamin, mineral formula, essential fatty acid, and so on. So we did 6 different things, and it was a randomized control trial, and we found really amazing improvements. Almost 7 points in nonverbal IQ improved. We found 4.5 times the developmental age improvement, improvements in language and social ability, and all sorts of physical health, mood, all sorts of things improved with the diet and nutrient approach. And then more recently, I published a paper on therapeutic diets, and we looked at 13 different therapeutic diets, and we talked to over 800 families on which ones helped and which symptoms they helped improve. So we looked at not only a gluten-free and dairy-free diet, but a specific carbohydrate diet, a paleo diet, a ketogenic diet, a low salicylate diet called a Feingold diet. And we found, interestingly, that different diets seem to improve different symptoms more than others. And so we were able to see that all the diets were helpful. And in fact, this survey also looked at nutrient supplements as well as pharmaceuticals, particularly psychiatric and seizure medications. And the diets outperformed both the nutrients and the psychiatric and seizure medications and the diets had a significantly greater improvement also, or a significantly lower risk of adverse effects than the psychiatric and seizure medications. So they did the best, and they had the lowest negative effects, particularly compared to the medication. So they they can really do amazing things. And I think a lot of times people think, oh, it's only diet, but the diets really did show really exciting improvements. And so we were, really thrilled to see how people were using them very specifically to help them with certain things.
Wow, that's incredible, and I absolutely believe it. I know I did a outcomes research with my community on the impact of, like, the gluten-free diet, and they said it worked better than thyroid medications in some cases. And I'm a pharmacist, so I'm a big proponent of using the right medications at the right time. But wow, like, that's just incredible when you can get the right kind of nutritional plan and support in place, and it's just like the body can heal, right? It's like the body just knows what to do if you take away whatever is driving the inflammation, or you're giving it something that it's missing. I wanted to ask you a little bit about maybe some of the common misconceptions about diet and autism that you encounter, and how do you address them with parents?
Oh, I would say the biggest misconception is that there's no science to diet and nutrition, and that it don't waste your time. I think that's the biggest one. That's not true. I mean, we just talked about two papers that I happen to be involved with. There are hundreds of papers, if not more, talking about what's underlying the condition, and all sorts of papers on how diet and nutrition can help improve the condition. So I think that to me is the biggest one, because a lot of times I will hear, don't get your hopes up. It's not worth it. It's too hard. It can't help. And sure, it is challenging. It can be challenging, especially if you have a picky eater, and most kids with autism are picky eaters. So if you have a child that has restrictive eating, you are not alone. In fact, it's the majority. But that when you do implement these, it can make a really dramatic difference.
I think that's really important to consider. And I'm kind of we have a list of questions, but we're gonna skip ahead a little bit, because you mentioned picky eaters. And I know that I am a proud former picky eater, and my mom had the hardest time with me when I was a kid. And so, I went through that time period probably until I was a teenager. I was very picky. And then I had my beautiful son, who then turned out to be a picky eater. And my mom and my brother are like, this is karma. This is like, this is what you get, like, God doing his work on you and whatever. And so it's challenging, right? Because I used to just think, when people were like, oh, it's hard for me to change my kid's diet. I'm like, just do it. Just do it. Like, like, make it happen. Like, you're the parent, right? And then I've got this beautiful, like, 2-year-old that's, like, totally in charge of me when it comes to diet, and it is very nuanced, and it's not so easy as just being like, "Okay, one day we're gonna wake up and give you different food." Can you talk about how do you approach picky eaters? Do you have any suggestions? And we do know that there are kids on the spectrum, I feel like, are notorious for being picky eaters, but I think this is, many kids in general too that can be picky eaters and trouble eaters, right?
Yes. So developmental delays, kids with developmental delays are about 80% of them have various picky eating habits. Kids with autism have more picky eating habits, so typically around three compared to say one, and they have very distinct picky eating habits that are different than other kids, so it is very, very common. And so whether you have a child with autism or not, there are things that you can do, and there's a variety of things, right? There's always looking at medical issues, making sure that those kind of things are addressed, but also just from a perspective, I like to things that all parents can do themselves is to really just look at what are your child's eating patterns? Are there things that they just won't eat? Do they not like small bits of things like rice, for example? Do they not like certain textures? And really dive in. So, yogurt is different than applesauce, which is different than mashed potatoes. They're all seem mushy to us, but to them, they are very different. So, what is it that they like and don't like? Do they only like crispy and crunchy foods? That's a really common one. So, I like to figure out, well, how can I make vegetables crispy and crunchy? So, kale chips, carrot chips, carrot fries, and taking little baby steps towards making changes over time, that can really go a long way. Is it anxiety over foods? Is it that green foods are gross? Where can you start? And just making tiny, tiny little changes, getting them trusting the new strange things and realizing, oh wow, these actually taste really good. So if I started with a kale chip, can I do it in another way? Or let's say carrots, for example. If I do a carrot chip, can I then do a carrot fry? Can I then do raw carrots? And then can we do carrots in a soup or something? That's usually the progression of texture that will often work. But if you won't eat any vegetable, going straight to cooked carrots may not be as successful as, let's say, starting with something that tastes like a potato chip.
I love these suggestions, and I remember looking at your website and some of your content when and your books when Dimitri was a toddler and he only liked crunchy things. So I had to get very creative because it was like some of the baby crackers, the gluten-free crackers that he liked, and I ended up getting like those dehydrated fruits and vegetables. They have like dehydrated strawberries and dehydrated broccoli and dehydrated like carrots and all kinds of stuff like that. And it was like, okay, we're making some progress. And then I was able to get him on like cooked broccoli. And so, yeah, it's quite interesting. You do have to be very, I guess, thoughtful in that process. And I know you do include some tips in your book about this as well. I love that you always include things that make things practical in your books rather than just being like, here's what you need to do and good luck doing it, right?
Right. Absolutely. Thank you. I learned early on that I could create the quote best diet, but if my client didn't eat any of it, we weren't going to get anywhere. So I always try to put practical things that parents can do. And I know it can be very overwhelming, especially picky eating. So I like to provide a lot of ideas.
Yeah, I know it's like if my husband had a challenge, I could be like, you need to eat this way and you need to take these supplements. We were able to get him into remission from ulcerative colitis, right? And we were like, this is everything you need to do. And he was like, okay, I'm doing it. And we were able to get him into remission within a few weeks. And he's been in remission for many years now. With my son, he had like eczema and there was like a list of supplements and diet and there he was not having any of it. Like it was just like not going to happen, right? And until we started to get a lot more creative. And I'm very grateful for you and your work because you have done this for so many years that you have a nice bag of tricks because it's like a lot of us that work with adults we're just like, oh yeah, you just do this and it's like, oh my gosh. So personally, personal thank you from my own heart. You mentioned that there are various therapeutic diets, right? So it's not just one. Can you talk about that? And I don't know if this is related to your 12-step plan. Does that connect? Maybe I think you mentioned maybe 13 therapeutic diets that you've studied.
Yes. So the book goes into even more diets than the study talked about. But generally, yes, there are 12 steps because I try to take people from very simple things that everybody can do that I find to be the easiest and most beneficial right off the bat. And then getting into more personalized diet approaches. Not everybody is going to obviously need every therapeutic diet. In fact, you might need one or two. So the kind of the second half of the book is really about learning about the different diets and figuring out if that might be a beneficial approach for that person. And so I go into what are some of the common symptoms from those types of foods, what our foods are high in that compound, what foods are low in it, so that parents can start to see, my child has a lot of these symptoms and they eat a lot of these foods, maybe I need to look at that more. So that, and I try to do it. So, for example, I try to do it in a very methodical way. So, for example, gluten free and dairy free is before the ketogenic diet, because if, and some people might jump straight to a ketogenic diet if they need to. So I'm not saying you can't do that. There are certainly appropriate reasons for some people to do that. But if you're trying to figure things out, if you go straight to ketogenic diet, you don't know, was it the low carb, the ketosis? Was it the low carbs? Was it the grain free and starch free? Was it the gluten? So if I start with just the gluten and then we go step by step through the diets, then it's easier, and then someone might not need as restrictive of a diet. If we jump straight to that one and it helps, we don't necessarily know what it was that provided the benefit.
Yeah, that makes so much sense. I remember when I was trying to do like a reintroduction diet, I was like, okay, I'm gluten-free and dairy-free. Let's eat a pizza. And then it was like, oh wait, I don't feel so good. But was it the gluten? Was it the dairy? Was it the carbs? Like what happened, right? I would love to know if you could walk us through one of the diets that you believe is especially beneficial for children with autism spectrum disorders and why that might be.
I'm skip over gluten free and dairy free because I think that's actually one of the ones I recommend the most. And but a lot of people know about that diet, or a lot of people in your community know about that diet. So I'm going to jump to the kind of first diet I talk about in the second half of the book, which is a low salicylate diet. And I mentioned that briefly. So salicylates are naturally occurring compounds that are a part of the phenol family or polyphenols. We often think of polyphenols as very good, nutrient dense compounds that are really wonderful. And they are very wonderful in terms of they can really, these foods can be things like grapes and berries and herbs and spices, and they're found in these types of really good nutrient dense foods. So people often think, how could this possibly be a problem? Maybe my child doesn't eat many vegetables, but they eat tons of fruits, and I'm so happy that they're eating berries and raspberries and blueberries and blackberries and apples and grapes and all these things. And thank goodness they're eating these really nutrient dense foods. And I would normally say absolutely. And for some people, that might be a wonderful addition. But for some people, these salicylates, they can overwhelm a particular detoxification system that we have that often is low in people with autism. A significant percentage of them have challenges with this particular system. And when that happens, then instead of, well, seeing wonderful health benefits and wonderful, behavioral benefits, we see a lot of irritability, aggression, red cheeks, red ears, hyperactivity, all sorts of different types of challenges with attention and focus and mood. And so, a lot of times parents will think, well, it can't be those things. But sometimes it is. And my goal is not to remove these foods forever because they are wonderfully nutrient dense foods, but it's to try to get to what is underlying them, what's causing the reaction to them, how do we boost up the nutrients and improve the functioning of those biochemical pathways, how do we remove any of the toxins or the gut environment that might be negatively affecting our ability to process these foods so we can go back to eating these wonderful foods.
Okay, thank you so much for sharing that. I think this is a very rarely discussed food sensitivity and I would say it's more of like a chemical issue with the detoxification of salicylates when your is it your glycine pathway, glycine conjugation that is backed up that can be
Yes,
implicated in that. But not many people know about this because it's very healthy foods, right?
absolutely. That is one of the pathways. The other one is sulfation. So either one of those, and you need. I often talk more about sulfation. Sulfation requires sulfate. There's various things that can deplete our sulfate, and also we need good methylation, which is, a very common challenge with many chronic conditions. And so we need a variety of these pathways working well in order to be able to detoxify these natural compounds. There are chemical versions of these compounds as well, but many people know to avoid those and don't realize the challenges with these naturally occurring ones.
I think I wanted to mention salicylates have been implicated in asthma, ADHD, and maybe some allergic conditions as well. Are there, I know, I think I read a initial history of them is that a patient, I want to say it was an allergy doctor that discovered that connection. And then the psychiatrist was like, what are you doing for this person? Like, because their psychiatric symptoms improved where he was trying to support their asthma. Is that kind of the pathway that you see? And perhaps maybe if there's a child with autism and asthma and some of these, I guess, pathways to consider that maybe like, hey, is that does that kind of come up as a red flag for you?
Absolutely. It was this was discovered back in the 70s by Dr. Ben Feingold, and he found improvements in ADHD, all sorts of learning challenges and behaviors way back in the 1970s. And so we've known about this for a long time. Well, a percentage of the population has been aware of his work for a long time, and it can make a really big difference. And so that's why my book, while it is on autism, because that's what I've spent most of my career helping families with, it also is very relevant for all sorts of other types of learning disabilities and ADHD and other types of things, Tourette syndrome, all sorts of things. So it's definitely an interesting factor, and it goes well beyond that. So sulfation is there was some really great work by two researchers, Rosemary Waring and Margaret Moss, and they looked at faulty sulfation and theorized that this was an event in, they say at the time, all chronic health conditions. That was their hypothesis. And they looked at motor neuron disease, IBS, depression, of course, ADHD, autism, those types of things you mentioned here. But they found a connection with many, many different health conditions. So I think it's an area that hopefully we will have more researchers talking about, because, like you said, it's one that rarely people hear about, even in my population, my community. But I think it's going to go I think it does go well beyond that. And I think people are going to be able to use that in a beneficial way going forward.
I think the issue is that a lot of the foods are just very healthy foods. So I believe apples have are high salicylates. And then the other thing that I think people may not be aware of, it's like I'm just going to pull up a list. It's like berries, grapes, apples, tomatoes, cinnamon, cloves, oregano, basil. For some people too, they may be sensitive to aspirin or NSAIDs. And some random things that I've seen is like peppermint essential oil. That's actually very high in salicylates. And sometimes we're like, we're diffusing these essential oils. And I want to say it was one of your case studies where you had a child that was actually felt worse whenever there was a Christmas tree in the house, right?
Yes. So they, and I just heard from them recently, which is interesting. This was many years ago. So salicylates are phenols. Phenols are aromatic compounds. So if you think of anything like herbs and spices, that we use them in food because they add that smell, that aroma that makes food taste good. Well, pine is one of those. So the pine tree does create these volatile compounds in the air, which make our home smell really good. But if we can't process them, this child was getting a lot of aggression, meltdowns, crying, during a time of the year, Christmas, when we hope we have some wonderful opportunities to hang out with family and celebrate and all of that. And as soon as they got rid of the tree, much of that dissipated quite quickly. And like you said, we think of essential oils, they're natural, so we're not using all those artificial fragrances. And certainly artificial fragrances could cause a big problem, so I'm certainly not recommending that. But people aren't aware that these substances can. And Wintergreen is a huge salicylate, as well as the mint family in general. So we just have to maybe be aware of some of these things. And when they're natural ones or really healthy foods like this, we often don't think of them as being a potential cause of part of the problem.
And I think, people might be listening to this being like, oh my gosh, cinnamon is so healthy and I love my essential oils. But you want to know what's driving inflammation in that particular person. And we also know that there are certain, it's not like we're going to be off of these healthy foods forever. It's going to be an elimination process. I know I found glycine deficiency or utilizing glycine can help support that pathway. And you talk about other causes that may lead to a person to be sensitive to salicylates. Can you talk about that a little bit, like gut related? I think you mentioned.
Absolutely. So, I mean, one simple gut thing is that when your gut is inflamed, you're not absorbing your nutrients. And sulfur is one of the biggest nutrients in our diet. And so we need to be able to absorb that. But what's, I think, particularly interesting is that a lot of the pathogenic bacteria produce compounds that are high phenols. So, P. cresol, for example. And when we have this bacteria, these pathogens giving off these poisons, these toxins, they use up all our good sulfate to try to detoxify them so they don't negatively affect us. And then we don't have all that good sulfate available that we need to process these good foods that we have. So those are just a couple examples of why somebody might be struggling with something. And as you say, doesn't need to be lifelong for most people. For most people I know, most of my clients, their sensitivity improves and sometimes improves to the point that it's not a problem anymore. Because many times it's because of an underlying factor that is causing the issue, that when we resolve those and improve the underlying nutritional status, then that isn't always a problem anymore.
Yeah, and it's incredible because even with just, people don't realize how powerful foods can be and the signals that they could send throughout the body. And we know that, of course, gut issues are notorious in all of the research in autism, right? And that's like a big focus. That said, it might take some time to shift those gut issues, but with the food changes, you can see results in like days. Sometimes just a few days, you can start seeing improvements in symptoms versus trying to go on like a 6 month gut rebuilding journey, which, to be real, it does take a long time to like really rebalance the microbiome. For me, it's like a minimum of 90 days that I would see that. Can you share some success stories from your work where these dietary changes had profound impact on a child's development or behavior or just how they were able to show up in the world?
Yes. So I talk about a lot of different stories in the book, but I'll share my favorite story, which is in the introduction, which is a young man now. He came to see me when I think he was 5, maybe, and he had a lot of challenges with his gut, with various dysbiosis. He had very little language, a lot of tantrums, a lot of sensory challenges in his environment and things like that. And his parents changed his diet, added supplements, and saw a doctor and did a variety of different approaches. But one of the things that his mom and he really attribute changes to was the use of diet. And so they did a variety of diets over time, a gluten-free, dairy-free diet. There was a period of time they came to see me, they needed a low oxalate diet. And, they went through a phase of different dietary approaches. They worked on the microbiome. They did nutrient supplementation. And this boy went from all of the things I just mentioned when he was young to now he graduated from high school. He is an Eagle Scout. He's going to college. He wants to be a writer. He's really doing amazingly well. I'm just so happy for him and I'm proud of him. And he, in the book, talks about towards the end how important diet was for him and still is today. And so it's nice to see somebody that can talk about the effects it had, but also can really, even today, see that it does make a difference and it's still an important aspect and component for him.
Incredible. I know you've helped so many children on your career, and I'm just so grateful for that and the work that you've done to really uncover that how impactful nutrition can be. I think people can feel discouraged because they might try a diet and they might not see results, but your book really teaches them to sort of be a nutritionist to figure out like, okay, if we're seeing this kind of symptom or this kind of issue, then perhaps we want to like maybe we don't start here, but we want to think about this diet, whether it's like ketogenic diet for seizures or another type of like pattern that you've noticed. So I really love that you offer all of this insight to patterns because it's easy to get discouraged when you've like tried one thing and then you're like, okay, well, it doesn't make a difference. But it's like when you target that nutrition, it can absolutely be game changing. I wanted to know, like, if you had a starting point perhaps for children with ADHD, if you might have a diet to start with, and then maybe children with dyslexia. These are both very, very common conditions. And there's oftentimes an overlap with autism. I oftentimes feel like a lot of the research goes into autism, and accidentally people find out that it also helps with like ADHD or dyslexia and all of that. And so I want to make sure parents with children with any kind of developmental challenges are supported.
Absolutely. Yeah. In fact, in the study we did on the diets, we looked at symptoms that improve. And a lot of these symptoms are things we looked at because they are comorbid conditions with people with autism. So we're seeing these symptoms improve in people with autism, but let's talk specifically about how they can help people that don't have autism, but just have these other conditions. So I would say the first thing would be the first step of my book, which is get out the junk, get out the junk food, get out the artificial colors, flavors, preservatives. I mean, we had studies. I mean, there was a study in 2007 in the Lancet looking at these artificial preservatives and dyes and things creating hyperactivity in neurotypical children. So it's just part of the negative effects of these compounds on your, you know, just children in general. And so if it has that effect on them, kids that have ADHD might tend to have, or dyslexia might tend to have more challenges possibly with detoxification, things like that, or deficiencies, that they would even react more strongly to them and need that even more. And that actually is also part of this low salicylate diet. So I think that's one thing. And that is something that Dr. Ben Feingold found really was these learning challenges and hyperactivity, attention, things like that. And so I would say that would be the first thing I would think of. And then to go along with that rest of that low salicylate diet, I feel like that one is a really good consideration for individuals looking for support in this area of ADHD and dyslexia, because so many parents see beneficial things. It's a diet that's been being used for decades for people with this. So I think that's a good one. I mean, yeah, I would say yeah, I think that's what I would say for them.
Okay, that's great. That's great advice because I feel like you have a lot of experience in seeing like how do we personalize it? How do we press the right buttons to really see the biggest benefits, right? I wanted to ask you about, just kind of a tangent question, but your thoughts about all of the dyes in our foods. I know I'm personally excited that like the red dye number 3 is being removed, but I'm kind of like, what about red dye number 40? Like there's so many other dyes that need to be removed, right?
Absolutely. And I like you am very happy that it's being removed. But like you said, there's still yellow dyes and other red dyes and all sorts of things that we know create challenges, and they're still in the food. And even red dye number 3 isn't going to be phased out for another 2 years. So I don't want parents to feel that it's safe now. It's still there for now. And there is a I find it interesting that was removed from cosmetics before it was removed from food. So we have to realize that just because it was grandfathered in many years ago, before the FDA, kind of put these rules into place, now in order to get taken out, it has to be proven to be harmful. I feel like it would be nice if we could just go back to the beginning and prove that they're safe before we allow them in. But hopefully we are seeing a tide change and we're seeing those artificial colors be removed, because you can make lollipops without them. There are lollipops without them. There are these same foods made in other countries that don't allow them. They have these foods without the dyes. And it's cheaper to make them with the dyes. It's more exciting, that apparently, about these colors. But do we really need these colors? I think that we don't need them, and that we would be much better without them. So let's hope that that continues to change in our favor.
Yes, I really hope so. And I saw a rumor that they were actually going to, the food manufacturers were going to change the names on the labels. So instead of like red dye, it was going to be, called another, like more of like the chemical name. So if I find that, I'll post a link to it in the show notes, because we just have to be more mindful of looking at our ingredients. And I mean, in Europe, I'm European and I grew up in Europe and I spent a lot of time in Poland where I'm from. But a lot of and have traveled around European countries, but a lot of the foods actually have like warning labels on them. It's like kind of like cigarettes, right? That have these artificial dyes, and it's almost like common knowledge and well accepted. And here in the States, where we're both based now, I feel like there's a lot of like that gaslighting into like, oh no, this has nothing to do with it.
Mm-hmm. Yes, and that's hard for parents. It's really hard for moms who notice a reaction, and then they're you know being seen in a negative way, and being told that what they're seeing isn't real, or it's silly, or it's not true, or it's not based in science. And it's really, really unfortunate. And so hopefully we'll keep changing that so parents can realize that what they're doing, they are going in the right direction.
Yeah, I know. It's been very interesting to see some of the differences just being, a dual citizen of like the things that happen nutrition wise in the European Union versus the United States, and also like the rates of various chronic illnesses in the United States, right? But I digress. I wanted to ask you, for parents just starting on this journey, what's the most important piece of advice you would give them considering a nutritional plan for their child with autism spectrum disorder or other types of conditions that respond well to nutrition?
I would say start where you can. Now, we're talking today about a lot of, some of them are sort of more advanced topics, some of them are more complicated topics, a little more, they takes a little bit of time and expertise to implement some of these diets. But start, and maybe their child is a picky eater, and maybe their child eats only a few things, and maybe they're just trying to get a fruit in. Their child doesn't even eat a fruit or something like that. And there's a lot of, things that they're realizing maybe they don't want in there. Just start where you are and feel good about every win that you get, because everything that you can change matters. Even we just talked about red dye number 3. They're taking that out. Just taking that out has benefit to all of us. So I think that that's the important part. There's always going to be people on different parts of their journey. So I like to talk about helping people no matter where they might be. But for people that might be new, getting a carrot chip in and getting one little slice of vegetable in, or as you said earlier, getting a freeze dried blueberry in, any of that is going to be helpful and is a positive. And little by little over time, you can make changes that will be more significant and seem more significant, even one baby step at a time.
I love that. It's kind of like progress, not perfection, right? It's like you're going to just do what you can. I know personally for me, I can get like overwhelmed sometimes when I have too
Mhm.
much information. And then it's like you try to do everything perfectly. And then I just have to be like, okay, Isabella, like you do not have to like do 75 things today. Like let's just do one thing at a time, right? And I think that that's
Yes.
just really incredible advice, because it can be quite overwhelming to be a parent. It could be overwhelming to have a chronic condition. It could be overwhelming to be a parent of a child with a neurodevelopmental disorder. And, when you have a chronic health condition yourself and you're a parent and your child has some challenges, it can be just a whole lot to deal with. And so I appreciate that you really help people break things down too into digestible steps. I did want to ask you a little bit about mitochondrial dysfunction, because this is a topic that's been talked about as something that's very relevant for kids on the spectrum. Are there nutritional things people can do to support their mitochondria?
There are. There actually a little story that I think will make it really relevant and show the power and importance of the mitochondria. In that first paper that I talked about on our randomized control trial, one of the 6 interventions was carnitine, and carnitine is a very important nutrient that is needed to help support our mitochondria, and it's found in red meat and in high amounts. And when not everybody needed or had profound improvements with carnitine, but there was one girl who was in a wheelchair. Well, when she went out and about in the world, she needed to be in a chair because she just didn't have the energy to walk more than a small distance. And so she always, when they went out anywhere, she was, in her chair. And then during the study, we realized that she wasn't eating these types of meats that were providing this carnitine. When the carnitine portion of the test, because we did the study, implemented more or less one intervention each month. So it was kind of isolated on its own. And when that happened, she improved dramatically. She no longer needed her chair. It is now in the garage somewhere. She's never needed it since. She doesn't use it now. So imagine the profound improvement in her life from that one nutrient. And so one of the reasons we included it is that a fairly significant portion of children with autism do have some sort of mitochondrial dysfunction, not mitochondrial disease, but a dysfunction of the mitochondria. And so nutrients, carnitine being one of them, can be very, very helpful. And I talk about others in the book, Coach Q10, things like that, that can really, really help support this mitochondria. And then getting a good, healthy diet is important too, but sometimes we might need to support the mitochondria in other ways as well. So, we certainly want a good diet with good protein, fats, and carbs, and that kind of thing. But and things that might be depleting the mitochondria or negative the mitochondria, we want to consider. But I think the thing that's valuable here is that there are things, and they can make a very profound difference. I don't know if this individual even knew, or I don't know if her parents knew that there was something going on with the mitochondria. So I think it's important to consider, and really can be something that you can see improvement with.
Oh, that's just incredible. I know I did a deep dive on carnitine because it can be incredibly helpful for people with thyroid fatigue. And it used to be considered like a thyroid antagonist, but now we know it's like a mixed agonist. So it can actually support people with an overactive thyroid and the muscle wasting that they see with that. Taking carnitine can be a big game changer. And then people who are hypothyroid also see that tremendous amount of improvement with carnitine. And I use it for people with brain fog. It can clear ammonia, which is a toxic byproduct we can have from our bacteria. And it's so incredible. I was looking at, how to support people with thyroid issues, and I came across so much interesting research on carnitine with developmental delays, with brain fog, and just incredible that one nutrient can help a person not need to use their wheelchair as much. I mean, that's life changing. So
Absolutely.
thank you for sharing that. What do you think about the TMG trimethylglycine supplement? Do you think this person said, do you think it's for everybody? I'm gonna guess you're gonna say no, it's not for everybody, but who might it be for? And for everybody listening, what does it actually do? What is it?
Yes. Well, you know me too well. You're right. I would say I can't think of one thing that's for everybody, right? Because we are all unique. But with that said, trimethylglycine is one very interesting nutrient. So it provides glycine. It helps with, so with methylation, we need to, I'll just simplify it down. In order to recycle and make more methylation, more methyl donors, we need to either use folate and a whole cascade of things. And a lot of people have MTHFR, or we have kind of this secondary pathway that uses trimethylglycine and or betaine, some people know it as. This nutrient can be very, very helpful and can support people. And methylation is so important for our DNA methylation, our gene expression, as well as all of the other things we talked about in terms of down cascades of glutathione and all the things that help support things we've been talking about. So there has been some really interesting use of it, research on it. I know some doctors in the autism space like it to help with things like speech and things like that. Again, it all depends on, what it's doing for that individual. So I don't want to like single it out as the only or the best thing for that. But yeah, it is a nutrient that we do use.
Interesting. So, my little story with trimethylglycine or betaine. So, in trying to take charge of my health with Hashimoto's and figuring out what was going on, I had this incredible, like, debilitating fatigue, and then I would notice that I would get more tired after I ate. So, somebody recommended betaine with pepsin to help me digest my food. And within 3 days, I was like, I have so much more energy. This is amazing. Like, I feel like a new human again. And at first, I thought it was just a low stomach acid thing. But it turns out like that betaine within the betaine with pepsin, is actually trimethylglycine. It's a beet derived nutrient that has this amazing alternative. It's kind of like the back door for the methylation pathway to support that process. And later on, I learned that I had the MTHFR mutation, and I was like, oh, okay, so this makes sense. It's like something that can be very, very helpful from a couple of different perspectives too.
Interesting, interesting. Yeah, there are different forms. So, parents can look at, the form that's going to be the most helpful, whether they want to find TMG or, whatever that might be. But thank you for sharing that. That's really interesting.
Yeah, kind of a random thing that I was like, oh, this how does this connect? Diana wanted to know if there was a best test for parasites, and I don't know, Julie, if you do you recommend parasite testing or any kind of testing with for kids with autism or kids that you work with?
I think looking at the microbiome is always important, very important, because as we talked about earlier, it can affect the gut, it can affect digestion, it can affect directly the brain from all the toxins that it can give off. So whether it's, I think all of it, parasites and bacteria, and all that's going on in there, I think is very, very important. And there are a variety of different ways to do that testing. There's new like shotgun genomics types of stool testing, and a variety of different PCR and different things like that. So I do think it can give a valuable insight into what's going on. And as we said earlier, if one of these things is going on, then it's important that their doctor know about it so that they can address it.
Great, thank you so much for that. I did want to ask you, some people say that diet doesn't matter for autism, that there is nothing parents can do. Do you have like a rapid fire way you would like to answer that?
I would say there is science, there is information, there are things that you can do, and I guess maybe I was going to say you could read all the science, but maybe my book, just that's my answer to people. Well, if you don't know, it's because you haven't looked for it, because it is there.
I love that. I didn't get a chance to ask you at the beginning, but what made you so passionate in working with kids and helping them thrive through nutrition?
You said something early on, and I thought, oh, that sounds like me. So you just have this desire to want to help people, and you found something that people were suffering and didn't have answers, and you found a way to help. And that's really what happened. I kind of stumbled upon it when I was in nutrition school. I wrote a paper on ADHD, and I interviewed this man, what I thought was going to be about ADHD, but he actually recovered his kids from autism. So we really spent almost the whole, it was supposed to be an hour on ADHD. It turned into 3 hours on autism. And I learned there was so much you could do that people didn't know about, and that these kids were really having a difficult time, and that there could be a profound difference, and there weren't a lot of people doing it, and a lot of people didn't know about it. And I just thought, I don't know, I like to help the underdog, I like to help people, and so I just thought, well, I guess this is it, I guess this is what I'm going to do now. And really, because I saw, it's so heartwarming to see people improve, that I just was, I had to do it ever since.
I really, really appreciate that. And honestly, as a mom, I'm like, I so appreciate you doing this because moms, yes, we're incredible researchers, but when you're taking care of a child, like you don't have that bandwidth. And especially if you have a child with challenges. And so you're sort of like an angel to, I feel like parents everywhere because you've taken all of these research out there and you've compiled it into like not only do you work with people to help guide them through the process, but you're also making it like available to the entire world through a book so that they can actually anywhere they live they can pick up this book and help their children.
Thank you. Well, I won't take the credit, but it's interesting you say angel, because this man that I interviewed, his name was Michael Lang, and he actually passed away from pancreatic cancer about, I don't know, over 10 years ago now. And I call him my guardian angel, because he's the one, right before he passed away, we were at dinner at a conference together. And he said, you remember back when I told you you should go into this? And he was like so proud. He's like, look at all this, stuff. And, and so anyway, I think of him as my guardian angel. So anyway, if I can be, helpful to people, that that really warms my heart. So thank you.
Oh, of course. Couple of more rapid fire things. What's the wellness hack you refuse to participate in?
I have never done the celery juice cleanse. I tend to not like anything that's like super, strict like that.
Yeah, I haven't done that one either myself, so I'm with you on that. The most outlandish thing you've ever tried for your own health?
I did colon hydrotherapy once. I don't know if you would consider that wild, or, but so I guess you could say that.
Oh my God, I've done that one too. And I was like, I made the appointment and I didn't even tell my husband where I was going because I was like so ashamed. I told him I was like going for a massage and then it was not, yeah, I'm with you. That was not something I'll be doing again. Let's just put it this way.
I would agree. I haven't done it since.
If you had the supplement police come to your house and say there's only one supplement you can keep, what would you keep?
That is such a hard one. Oh, I think I might say medicinal mushrooms. When you talk about your cold, your cold, medicinal mushrooms for me can knock out my cold almost immediately. So for me, that one is a great one and is a favorite. And maybe I'd say vitamin D, because I tend to always have vitamin D, low vitamin D. So I'd say that, okay, well, pick the immune system boosters. I would say that would be mine.
Okay, so like reishi, is that one?
Yeah. So there's usually like a combination of them in like a blend. So I usually get a blend of, 3 or 4 or 5 different ones that are good immune boosters.
Oh, amazing. That's great. If you have that, we can share it in the show notes if you have a brand that you like.
Absolutely. Happy to do so.
What's your guilty pleasure that totally isn't like, people would see you, they're like, I can't believe Julie Matthews is doing that. Do you have any of those?
Well, I do love chocolate and I do love wine. Although right now I'm not doing either of them. So I'm kind of bummed about that. But I would say that those are probably two of my favorite guilty pleasures.
Okay, great. I have more than one guilty pleasure, and those two are definitely on there. I have like a long list of them. So thanks for so much for sharing. Can you tell us a little bit if you have any, maybe it's your own body or if it's a client that you're working, what's like a biggest red flag that tells you something is off, where maybe they're following a plan and it's just not working and you're like, okay, this is really off.
I mean, I guess the first thing I would do is if they have a symptom that they're trying to address and it's just not getting better or it's getting worse, but that's like kind of general. It's hard to say. And I would say that it kind of depends a little on the person and what's going on for them. So that's a little bit of a tough one for me. I would say digestive issues always kind of clues me in that there's a challenge. And that one is something that you can often see very quickly. So I think that would be my answer on that.
Okay, I like that. I know I typically like when I went gluten-free and dairy-free, like my acid reflux and IBS symptoms went away within 3 days. Do you have a timeline for symptoms improving on diets?
It depends on the diet. So if it's something like gluten or salicylates or something like that, it's usually more quick. Like you said, like a few days to a week or so. If it's something like oxalates or things, it might take weeks or longer. And actually, I taught in each of the steps of the book when I talk about all the diets, I say how long I suspect it might take before you see results. So that's why it's a little hard for me to answer that just because every diet's a little different.
Okay, I love that. I love that you've gone into that because that's so incredibly helpful for people planning to get ready for this. And it's like how some people have been on a diet for like a year and nothing is getting better. And that might be like too long, right? Or some people might be on it for like 3 days and they're like, I'm seeing nothing, I'm giving up, right? And so that's really relevant information. I would love for you to tell us more about your book, where people, what's in it, where people can find it, and all that good stuff.
Absolutely. So it is the Personalized Autism Nutrition Plan. And the book, you can find it anywhere. So, all your major retailers.
Amazing. I can't wait to pre-order my copy. I have like the digital version, but I also want like the printed version. And so you also are giving another free resource to our community.
Absolutely. So it's a guide of 5 things that they can get started with right away. So just things to help them, kind of my top 5 for first 5 things that can help families.
I love that. And then this is going to be personalized autism nutrition plan.com/ 5 key nutrition strategies for autism. And I'm also going to provide a link to that in the comments in the show notes. And I'm like, I really hate to let you go because I'm loved being here with you and picking your brain, but we're kind of coming up to that time mark. Can you tell people where they can find you and learn more about your work?
Absolutely. So they can find me at that website where my book is, personalized autism nutrition plan.com, or they can find me at nourishinghope.com. Either location, they can find all sorts of information that can help them and get them started.
Amazing. Julie, thank you so much for being here with me. And thank you so much for the incredible work that you're doing to help children and parents everywhere. So, your work is making a difference. Um, I think this has been a very healing conversation. And to everybody listening, thank you so much for tuning in.
Thank you, Izabella, for having me.